You might be an infected person too. Today, let's talk about herpes. What comes to your mind when you hear the word herpes? Many might associate it with a sexually transmitted infection prevalent among promiscuous individuals. However, herpes is a diverse group of infections, and it's not necessarily transmitted solely through sexual contact. It affects a wide range of people, from young children to the elderly, making it a contagious condition that goes beyond sexual encounters. There have been numerous cases reported, even in kindergartens, where herpes has spread. In 2012, the World Health Organization conducted its first-ever global survey on herpes epidemiology. The results revealed that 68% of adults under the age of 50 worldwide were infected with the herpes virus. In 2015, World Health Organization reported that approximately 3.7 billion people globally were infected with the herpes virus. Statistics in the United States show that 50–80% of adults have oral herpes. This makes herpes one of the most common contagious diseases worldwide, much like the common cold, something almost anyone can contract. However, unlike the common cold, which often resolves with rest and medication, herpes is incurable and tends to recur persistently, posing a significant and ongoing health concern. Until now, there hasn't been a cure to completely eradicate the herpes virus. The available treatments typically focus on relieving symptoms or preventing outbreaks through antiviral medications. It's shocking to know that herpes, which causes symptoms like sores or blisters, is considered a sexually transmitted infection, and more than 50% of the world's population is affected. Moreover, the fact that about half of those infected are asymptomatic carriers adds to the complexity. Is it okay for us to live with this? There are over 80 known types of herpes viruses, and among them, 8 are known to infect humans. The most common ones are herpes simplex virus type 1 and herpes simplex virus type 2. Among the two types, commonly associated with sexually transmitted infections, the herpes most often thought of when we refer to it is type 2. Interestingly, the herpes virus that affects over 50% of the population is type 1. While categorized into type 1 and type 2, their symptoms are quite similar. Herpes symptoms, whether type 1 or type 2, are divided into initial and recurrent episodes. The initial outbreak refers to the first herpes infection. During the initial herpes infection, which typically occurs between 2 to 20 days after exposure, the infected area turns red and develops small blisters. These blisters progress into pus-filled sores within 3 to 4 days, eventually forming scabs that fall off. Some individuals may experience piercing pain at the infection site, as well as muscle aches, joint pain, headaches, fever, fatigue, loss of appetite, among other symptoms. However, these symptoms typically subside naturally after about 3 weeks without any specific treatment. However, it's not a complete recovery. Instead, it transitions into a latent infection. In this latent phase, as there are no apparent symptoms, one might mistake it for being cured. Yet, as mentioned earlier, herpes remains an incurable condition in modern medicine. During the latent infection phase, the viral particles lie dormant within nerve cells, typically distant from the initial infection site. They stay inactive until the immune system weakens, at which point they become active, causing a recurrence. This recurrent phase of herpes is termed recurrent herpes simplex. Unlike the initial outbreak, recurrent herpes tends to have milder symptoms and often resolves naturally within 1 to 2 weeks. It's reported that herpes recurs approximately 4 to 7 times a year on average. More than half of the patients experience recurrences more than once a month, 33% have recurrences every 2 to 4 months, and 14% have recurrences less than once every 4 months. Now, what's the difference between type 1 and type 2? The major distinction lies in where the sores appear. For type 1 herpes, typically oral herpes, outbreaks manifest around the mouth. Have you or someone you know ever had blisters around the lips when having a severe cold, experiencing high fever, undergoing periods of immune suppression, intense stress, or during menstruation? Unfortunately, people who experience these symptoms are likely to have type 1 herpes. If you've never had sexual contact and wonder why you might have herpes, it's because the primary transmission route for type 1 herpes isn't sexual contact. It's often transmitted by sharing utensils, towels, lipstick, etc. with an infected person. Therefore, type 1 herpes is not a sexually transmitted disease. Anyone, regardless of age or gender, can easily contract it. As a result, it's widespread, especially among children and adolescents. Once infected, a person can unknowingly continue to spread the virus to others. The fortunate aspect is that the primary symptom of type 1 herpes, oral herpes, usually heals in about 7 to 10 days, leaving behind redness or pigmentation. Excluding its contagious nature, it's generally considered a relatively mild condition, not posing a severe threat. But type 2 herpes, as mentioned earlier, is classified as a sexually transmitted disease. Type 2 herpes primarily infects through sexual contact, leading to eruptions in the genital area. It is a common affliction among sexually active young adults, affecting both women and men. Genital sores accompanied by pain, severe itching, irritation, discomfort during urination, increased vaginal discharge, etc., disrupt daily life. When an infected woman becomes pregnant, transmission to the fetus can occur. Additionally, type 2 herpes has more associated problems than type 1, such as its role in causing cervical cancer. However, in recent times, the distinction between type 1 and type 2 herpes is blurring. This is due to increased oral genital sexual activities compared to the past. As many may already know, even if a person has type 1 herpes and engages in oral sex, yes, type 1 herpes can be transmitted similarly to type 2. Why do we live without knowing we have herpes even when symptoms are clear? Just like some people with COVID-19 exhibit severe symptoms, while others remain asymptomatic, herpes infection doesn't always manifest symptoms. Especially in the case of genital herpes, individuals might be carriers without being aware of their infection, frequently transmitting the virus to others. Herpes, whether asymptomatic or during the dormant phase, has about a 30% chance of causing symptoms. Given that herpes can be transmitted even when an infected person appears healthy, it's challenging to pinpoint exactly how one got infected. In our modern society, where casual encounters are relatively common, tracking the exact route of herpes infection becomes even more difficult. Considering that herpes is not fatal and may not pose significant problems unless someone is experiencing pain or has a weakened immune system, one might think it's not a big issue. Yes, that's a valid point. Herpes is considered a chronic condition with a high transmission rate, but we don't worry excessively when we catch a cold. There's no need to be overly fearful. However, it's also a problem not to have any awareness. Although the precise causation is not fully understood, there are numerous studies suggesting a connection between herpes and conditions like dementia. Dr. David M. Holtzman, a professor at Columbia University's Vagelos College of Physicians and Surgeons, has been researching the relationship between herpes viruses and Alzheimer's disease for over 35 years. He has mentioned that there is indirect evidence supporting a connection between the two. In 2021, a study in Sweden involving 260,000 participants indicated that type 1 herpes simplex virus could increase the likelihood of developing Alzheimer's by 50%. So while it's not a direct and conclusive link, there is growing evidence suggesting a potential association. The World Health Organization has emphasized the need for a change in perception regarding herpes, stating that, especially for young children and individuals with underlying health issues or weakened immune systems, herpes can be potentially fatal. So if one is currently not infected with herpes, it's advisable to take precautions to avoid getting infected. Simple measures can go a long way in preventing transmission. Firstly, it's crucial to avoid contact with individuals showing symptoms of herpes. To prevent type 1 herpes, refrain from lip contact with someone displaying symptoms. Also, avoid sharing items like cups, forks, or straws that come into contact with the lips. For women, extra caution is needed with shared items like lipstick and other cosmetics. Lipsticks tested in makeup stores are used by numerous people, so using them requires careful consideration. Preventing type 2 herpes primarily involves avoiding sexual contact with carriers of the virus. Ideally, engaging in sexual activity with a partner who has undergone a sexual health check is recommended. If, despite taking these precautions, someone unfortunately contracts herpes, the best course of action is to seek appropriate medical treatment. While there isn't a cure for herpes, medications can help alleviate symptoms, reduce their severity and duration, and decrease the likelihood of complications. In a study mentioned earlier regarding Alzheimer's disease and herpes, there was a significant difference in the incidence of Alzheimer's between those who sought treatment for herpes and those who did not. This underscores the importance of medical intervention. Regular comprehensive testing for sexually transmitted infections, including herpes, is recommended. Getting tested is not something to be ashamed of. It's a responsible and considerate step towards ensuring your health and preventing the potential spread of infections to partners or spouses. Remember, seeking medical help and getting tested is not only crucial for your own well-being, but also plays a role in protecting the health of those around you. I hope this information has been helpful to you. Subscribing and liking the video are a great help. Thanks for watching.